Here's something most people over 60 have never been told. The way doctors actually check your fall risk isn't a scan, a blood test, or a questionnaire. It's a test you can do right now in under a minute, standing in your kitchen. And here's the part that should worry you a little. You can feel completely fine, walk without a cane, do your errands, live your normal life, and still fail it. Stick with me for the next few minutes because by the end you'll know exactly where you stand. Not a guess, not a feeling, an actual number. And you'll know exactly what to do with that number once you have it. The stakes. Let's start with why this matters, because the numbers here are bigger than most people realize. Right now in the United States alone, more than 14 million adults over 65, that's one in every, fall at least once a year. Falls are the single leading cause of injury and injury-related death for people in this age group. In 2024, over 43,000 older adults died from a fall, not a car accident, not an illness, a fall. Sit with that number for a second. 43,000. That's more than the number of people who die every year from certain well-known diseases that get far more attention, far more funding, and far more headlines. And yet falls barely come up in conversation until they've already happened to someone we know. Here's the detail that changes how you should think about this. Fewer than half of people who fall even tell their doctor about it. They brush it off. I just tripped. I wasn't paying attention. It's nothing. A stumble in the kitchen, a slip getting out of the shower, a near miss on the stairs that ends with a hand grabbing the railing just in time. These moments get filed away as small embarrassments instead of what they actually are, warning signs. And that's the real problem with falls. They rarely come out of nowhere. The body usually sends signals first. Small changes in stability, small hesitations, small losses of control, long before the fall that actually lands someone in the hospital. The trouble is, most of us have no way of noticing those signals because we don't have a baseline. We don't know what our balance is supposed to feel like, so we don't notice when it starts slipping. It's also worth understanding why this happens in the first place, because it isn't just getting older in some vague sense. Balance depends on three systems working together. Your inner ear, which senses motion and head position. Your eyes, which give you visual reference points and sensors in your muscles and joints, especially in your feet and ankles, that tell your brain exactly where your body is in space. With age, all three of these can quietly lose some sharpness, and your brain has to work harder to stitch the information together into something you can stand on. Add in muscle strength that fades if it isn't actively maintained, and you get a slow, often invisible decline, one that doesn't show up in daily life until the day it suddenly does, usually in the form of a fall. That's exactly why researchers have spent years trying to find a simple way to catch this early, before the fall, not after it. And here's what they found. A large British study tracked over 2,000 people, testing their balance at age 53, then again in their early 60s. This wasn't a small pilot study. This was a long-running, decade-spanning look at real people, followed over real time. The people who could only hold a single-leg balance for under 15 seconds at both those points were more than 3 times as likely to have repeat falls by the time they reached 68, compared to people who could hold it for the full 30 seconds. 3 times. That's not a small difference. That's the kind of number that should make you want to actually check. Not guess. Check. Why this test specifically now? I'm not going to hand you some random exercise I made up or something I saw in a wellness magazine. What I'm about to walk you through is the 4-stage balance test. It's literally part of the CDC's official fall prevention toolkit, the same one used in clinics and physical therapy offices across the country. It's built into a program called STATI, which stands for Stopping Elderly Accidents, Deaths, and Injuries, and it's the same basic screening a physical therapist would run you through in an actual clinical assessment. Researchers rank it as one of the most reliable balance screenings that doesn't require any equipment at all. Just you, a stopwatch, and a wall or countertop nearby for safety. No machines, no appointments, no waiting room, just 4 positions and a timer. That last part matters, so let's be clear about it before we start. This is a screening test, not a stunt. You are not trying to prove anything to anyone. If at any point you feel unsteady, you reach out and touch the wall. That's not failing, that's exactly what the wall is there for. The goal here is information, not risk. So set yourself up properly. Stand near a wall, a countertop, or the back of a sturdy chair, something that won't slide or tip if you lean on it. Wear shoes you can balance in, or go barefoot if that's more stable for you. And have a phone or a clock nearby so you can actually time yourself instead of estimating. The test step, there are 4 stages. Each one gets a little harder than the last, because each one removes a little more of the stability your body normally relies on without you even thinking about it. You're aiming to hold each position for 10 seconds before moving to the next. Here's exactly how to do it. Stage 1. Feet together. Stand with your feet flat, side by side, touching each other completely. Arms at your sides or crossed over your chest if that feels more natural to you. Keep your eyes open, looking straight ahead at a fixed point, not down at your feet. Hold that position for 10 seconds. This one should feel easy for most people. It's essentially how you stand while waiting in line at the store, but pay attention to how it actually feels. Is your body making tiny constant adjustments to stay upright? A little sway is normal, but if you're struggling here, genuinely struggling, swaying heavily, needing to grab the wall almost immediately, that's actually important information, and we'll talk about exactly what to do with it in a minute. Stage 2, Semi-Tandem Stance. Now bring one foot forward so the heel of your front foot is touching the side of your other foot's big toe, like a half step, offset to the side, rather than directly in front. Hold for 10 seconds. Then, if you want a complete picture of your balance rather than just one side, switch feet and try it again with the other foot forward. You'll likely notice this one asks a bit more of you. Your base of support is narrower now, so your muscles have to work a little harder to keep you steady. Stage 3, Tandem Stance. This is the heel-to-toe position, like you're standing on a tightrope or walking a straight line for a police officer. Front heel directly in front of the toes of your back foot in a straight line, no gap between them. Hold for 10 seconds. This is where a lot of people start to notice the real difference between how they think their balance is and how it actually is. It's common to feel completely confident walking around your house all day, and then feel genuinely surprised at how much this stage asks of you. That surprise is exactly the point of the test. Stage 4, Single Leg Stance. Lift one foot completely off the ground. Doesn't matter how high, even an inch counts. You don't need to lift your knee up to your chest. Hold for as long as you can, up to 10 seconds. Then, if you'd like, repeat on the other leg, since balance can differ noticeably between your left and right side. This is the stage that showed up again and again in the research we just talked about. It's the single best non-equipment predictor of fall risk we have. If there's one number from this entire test worth remembering, it's how long you held this stage. If you get through all 4 stages, holding each one for the full 10 seconds, that's roughly 30 to 40 seconds total, and that puts you in a genuinely good position. It's a strong signal that your balance system, the combination of your inner ear, your vision, your muscle strength, and your nervous system, is all communicating and working together the way it should. What your research actually means. So what happens if you don't make it through? Let's go through this honestly, stage by stage, because a vague result doesn't help anyone. A specific one does. If you couldn't hold stage 1, 2, or 3 for the full 10 seconds, that's considered a real signal. Researchers classify that as a marker of higher fall risk, and it's worth an actual conversation with your doctor. Not out of panic, out of usefulness. This is exactly the kind of thing a physical therapist can assess further, figure out the specific cause of, and, more importantly, actually help you improve. Balance problems can come from several different places: inner ear issues, vision changes, medication side effects, nerve sensitivity in the feet, or simply muscle weakness that's crept in gradually without you noticing. A professional can actually narrow that down. You don't have to guess at the cause on your own. If you made it through the first 3 stages but couldn't hold the single leg stance very long, go back to that number from earlier. Under 15 seconds was the line where risk started climbing sharply in that British study. If that's where you landed, don't panic, but don't ignore it either. Consider it useful information rather than a verdict. Write your number down somewhere. Test again in a month. See if it's moving in the right direction. Here's the thing I want to be really direct about, because it's the part that actually matters most. Balance is trainable. This isn't a fixed number stamped on you forever, and it isn't some unchangeable fact about aging that you just have to accept. Unlike a lot of things about getting older that genuinely are out of your hands, balance responds to practice, sometimes surprisingly fast. Studies on structured balance training have shown measurable improvement in stability and fall risk in as little as a few weeks of consistent practice. 2 things consistently come up in fall prevention research as genuinely effective, and neither of them requires anything fancy. Balance and strength training. Something as simple as practicing these same stances a few times a week, safely, with a wall nearby, builds the exact stability this test is measuring. You're not just testing your balance with this exercise. You're training it. Every time you hold one of these positions, you're asking your ankles, your hips, your core, and your nervous system to communicate better with each other. That communication is a skill, and like any skill, it improves with repetition. Tai Chi. It shows up repeatedly in fall prevention programs recommended by health organizations worldwide, precisely because it improves balance, leg strength, and body awareness together, at a pace that's accessible regardless of your current fitness level. It's slow, it's controlled, and it's built almost entirely around shifting weight smoothly from one leg to the other, which happens to be exactly the skill that prevents falls in the real world, on real uneven ground when something unexpected happens underfoot. Neither of these requires special equipment. Neither requires a gym membership. Both are things you can start this week, in your own living room, There are a few smaller things worth mentioning too, because fall risk is rarely about balance alone. Your vision plays a bigger role than most people think. An outdated glasses prescription can quietly throw off your depth perception without you noticing day to day. Certain medications, especially ones that cause drowsiness or dizziness, can affect stability, so it's worth asking your doctor or pharmacist directly whether anything you're taking might be a factor. And simple home changes: better lighting on stairs, non-slip mats in the bathroom, clearing loose rugs and cords from walkways, remove a lot of the risk factors that a good balance score alone can't protect you from. So here's what I want you to do. Not eventually right now if you're in a safe space with a wall or counter nearby. Run through those 4 stages. Time yourself honestly. Get your real number. Because the whole point of this test isn't to scare you, it's to replace a guess with a fact. I feel fine and I tested fine are 2 very different things, and only one of them is something you can actually act on. Feelings are easy to dismiss. A number, written down, timed with a stopwatch, is much harder to argue with. If you made it through all 4 stages, that's genuinely good news, and the goal now is just to maintain it. Keep moving, keep practicing, and don't let a good result turn into an excuse to stop paying attention. If you didn't make it through, you now know exactly where to focus, and exactly why it matters. In numbers you can trust, not hype. That's not a bad outcome. That's actually the best possible outcome of watching a video like this one. Walking away with something specific you can act on today, instead of a vague sense that you probably should be more careful. And if you're watching this with a parent, a spouse, or an older neighbor in mind rather than yourself, send it to them. Not with a message that sounds like a warning, just something simple. Try this, it only takes a minute. That single message, and the minute it takes to act on it, is often the entire difference between catching a problem early and finding out about it in an emergency room. Drop your result in the comments, which stage you got to, and how long you held it. It helps other people watching see that they're not alone in whatever number they land on. And if this was useful, the next video breaks down exactly why most falls happen inside the home, not outside it, which might genuinely surprise you.